I like to break it down into decades of life when we consider this, and if we start in the 20s, you can get away with a lot of stuff in your 20s in terms of your wellness, but it sets the foundations for the rest of your life. So we're thinking, don't take up smoking and vaping, moderate your alcohol, get lots of exercise, manage your stress, and wear sunscreen. But you don't need to be coming in annually for a checkup. In your 30s, increase that exercise, look after your mental health. Huge amounts of stress come on in our 30s. We take on mortgages, we get kids, life gets more difficult. Really make sure you've got an outlet for that stress, for any worries you have, good friends you trust, and maybe your doctor if things are difficult. In your 40s, we start to think more about those annual checks. It's time to get an initial prostate number. It's time to check if there's any evidence of diabetes, to consider your family history, to look at your blood pressure, to look at your weight. Really have a consideration of all those lifestyle factors. And then we get into our 50s, we start to think about bowels. You should really be getting a skin check pretty frequently there. Melanoma is more common in New Zealand than any other country, and of course, it can be fatal if we don't find it early enough. So go and have a skin check every year to 2 years, according to what your GP or your dermatologist says. Get your blood pressure done, and if you're starting to develop any conditions, or if you need meds or monitoring, then liaise with your doctor about what that looks like. Into the 60s, we want to really set you up for a healthy, good retirement. So let's make sure that we've got that longevity going forward. But if you're starting to get some arthritis and things, we can look at how we can manage those so you can stay as active for as long as possible. As we get older than that, absolutely, I think you're going to be in at least annually. And that's really to discuss what's going on, look for those symptoms, try and keep you as well as possible and manage any conditions that you have ongoing.